Hello and welcome. You're listening to Epic Podcast, Emergency Preparedness in Canada. In this unedited video version of the podcast, we are talking to Dr. Vincint Covello. Dr. Covello is the founder and director of the Center for Risk and Communication, and he is a global expert and practitioner on risk, high stress, and crisis communications. He's the author and co-author of more than 150 articles and the author or editor of more than 20 books, including Communicating in Risk, Crisis, and High-Stress Situations, Evidence-Based Strategies and Practice, which was just released. So please pull up a chair and watch as we discuss what's with the toilet paper and crisis communications during COVID-19. All this and more on this episode of Epic Podcast, Current, Relevant, Canadian. Dr. Covello, thank you so much for joining us on this Epic podcast. I'm wondering if you could just tell us very briefly about yourself and your interests.
Sure. I'd like to think sometimes that I wear three different hats. The first hat is a teacher, second is a researcher, and a third is a practitioner. Teaching, I've been teaching at universities now for close on 35 years, starting at Brown University, Columbia University. I do workshops quite a bit before COVID, especially before COVID, although a lot of virtual stuff nowadays. In terms of the research, I published quite a few articles, quite a few books together. In fact, I have a recent book. I'll do a pitch. This is the most recent book, just came out 2 days ago. It's called Communicating in Risk, Crisis, and High Stress Situations, Evidence-Based Strategies and Practice. And that really is a summary of all the research I and my colleagues have done over the last 35 years. It's about 500-page book, so it's pretty dense. What also was interesting, though, I started every chapter, and this is the third, practitioner. I start every chapter with a case study. Actually, more than case study, a case diary, something that I've been involved in personally over the past 35 years, where I've applied the principles of risk or crisis or high stress communications. So I actually try to do what I tell people to do. It's the old-fashioned, those who teach can't do. So I actually go in the field and do what I write about and what I teach about, that I actually do it and get on the front lines themselves. It's one way that you actually, Gracie, let me ask you, have you ever noticed that sometimes things you learn in a classroom are not applicable to real life? I'll throw that out as a question to you.
I think I can solidly say yes, that is often the case. Theory, practice sometimes don't quite align.
There it is. So one of the ways I get that alignment is by taking the research, taking what I teach, and seeing if it really works in specific circumstances.
Perfect. Well, congratulations on the new book. Yeah. Now, we've been chatting on and off during COVID about many things to do with crisis communication and effective crisis management. One of the most interesting things that happened early on in COVID is, of course, the great run on toilet paper. Dr. Covello, what's with that? Why did people rush around toilet paper, and what lessons can we glean from this to do with crisis communication?
Good. Well, that particular case study also was a case diary for me as well, something that I personally was curious about. I'd gone through, this is in the beginning of the pandemic back in March of 2020, and I went to the supermarket simply to buy some goods and went over to buy some toilet paper. And I noticed something strange, which is that the rack, the shelf with the toilet paper was, for all effective purposes, almost empty. And there was someone right in front of me, and she grabbed the last rolls on the shelf and put them into her basket. And I asked her very politely, I said, do you think you just took the last, I think you took about 20 rolls that were left. And I asked if I could have one, and she said, no, you can't have it. At which point I tried to have a conversation, and she rolled her cart away, and I had no chance even to use my risk or crisis communication skills as a way to persuade, influence. There are three things you try to do in risk communication. You try to build trust. You try to inform decision-making. You try to, as best you can, to influence behavior. And I was trying to influence her behavior, and she gave me this very direct no. Now, the no, I know, activated my amygdala. There's different parts of the brain that are activated in high stress situations. In neuroscience, we know that there's at least 3 parts of the brain that are activated when we deal with a potential harm, especially serious harm. Starts off the amygdala, the fight part of the brain. Then there's some middle parts of the brain get involved. There's something called the periaqueductal gray part of the brain, which gets involved. That has to do with freeze or flight or flight, right? 3 parts, fight, freeze, or flight. And so at first I was tempted to fight her and grab one of the toilet papers back from her. Freeze is just really is what I did. I just stood there in a frozen mode of what could possibly motivate a person to want to take so many rolls of toilet paper and deny that to another person. And then flight was just go to another store and see if I can find some toilet paper somewhere else. So I started thinking about this, and I did actually a fair amount of research. I do write up the case diary and the case study in that book that we talked about before. And it turns out that it's a much more complicated phenomena than I thought. In fact, there were at least 9 different variables involved in influencing her perceptions and her behavior. Everything from personal control, scarcity, primal fear, the unfamiliar, the uncertain, social media, options to toilet paper, what she sees other people are doing, guidance from others, distrust based on poor management or poor communication. And finally, there's only so many things you can worry about in life before you start exceeding what's called your worry budget. Three particularly really interested me. Do you mind if I just say a few couple of words about just 3? There's a key principle of risk mitigation called the magic number 3, is that too long a list tends to create discomfort, let alone stress. So, well, let me ask you, Grayson, let me ask you, what do you think was going on? And then I'm going to compare what you thought was going on against, again, this rather lengthy psychometric neurological research that I did on the behavior. This was to satisfy my own curiosity, but it turned into, I think, a quite interesting case study. So first of all, did you experience that? Did you run out of toilet paper and run into the great scarcity?
Unfortunately, I was too mired in COVID response to even shop for toilet paper. So luckily, I missed the great toilet paper scarcity. But I do think it's a really interesting microcosm of the intersection of some disaster myths and then perceptions of human behavior in general. You know, from my perspective, I saw this as a resurgent of this myth of kind of mass panic. And I saw this idea of panic buying in the media pop up again and again. But here I am as an emergency manager, thanking our lucky stars that finally people are actually taking the preparedness messaging seriously. For years and years and years, we've been telling people to go out and stock up and buy the essentials. And we even had our chief medical officer of health say, go be prepared to isolate and be sick for 2 weeks. And finally, people were actually heeding the message. So that was my take on the situation.
Well, when you mentioned also it's called the literature is called the myth of panic. Is that we see so many Hollywood films where people are running down the street, screaming, yelling, pulling their hair out, for example, ripping clothes off, etc. The evidence actually indicates that panic is a very rare event, that a number of variables have to be present for true panic, a contagious fear that affects us to think only about ourselves. That's a definition. A contagious fear that makes us think only about ourselves, or perhaps of our close relationships. And those variables are, once again, the literature indicates it's more complicated than it may appear on the surface. It starts off with, there has to be an immediate and clear source of harm, that you're going to be hurt by something. It has to be immediate and clear. Gray areas tend to disappear, that you see yourself immediately a threat, which again activates the amygdala, that fear part of the brain, such as fight, freeze, or flight. You have to perceive there's insufficient time to get away from the harm. You have to perceive, and these are all perceptions, there's only a very small or no chance at all of escaping harm. There has to be no easily identifiable options to what you can do. Quite literally, there's you just look around and say, there's only one option available to me, as opposed to other options. You see lots of bottlenecks, congestion. there's also a very interesting perception of first come, first served, which means if I don't do something now, it's not going to be available to me as an option to deal with it. And probably the most important, or at least the second most important, is the perception of inadequate risk communication, crisis management. I'm not getting assistance from anyone, no one's telling me what to do, or there's inconsistent messages, and therefore I panic. Now, it does happen. The Astro World, do you remember, Grayson, the Astro World in Houston at the concert? I would argue that was a case of panic, that we had effectively all of the variables involved present at the same time. And horrible consequences, 10 people killed in the process, apparently by suffocation, over 300 injured. But nonetheless, there were all these characteristics were present at that particular case. And to find examples of where all of these variables are present, there's 9 in total, is a very rare circumstances. And I'm thinking back also, there was recently an analysis of COVID, and in one of the interviews with a very senior person, I'm not going to mention names in the US government, that there was withholding of information about COVID because of fear of panic. And I would have hoped that that checklist of 9 variables would have been present. Do we really have, for example, poor perceptions of crisis management communication, or poor inconsistent communication? Do people really perceive it as first come, first served? Do people really perceive it as there's no identifiable options? For example, there's nothing they can do to escape the harm. So if we take panic off the chart, then we get involved with the toilet paper situation in a much more complex psychological event. Example, one of the factors that influences panic, those 9 variables, is the perception of lack of control. It's one of the most important, what is called risk perception factors. I don't have any control of the situation. The world is out of control. And now I can get some control back by buying toilet paper. Finally, I can do something to protect myself. There's a perception of scarcity out there. If I don't get the toilet paper now, I may never be able to get toilet paper again. And if I pick out a third one, which gets into a deep psychiatric perspective, toilet paper is involved with some primal fears going back to toilet training, Freudian stuff, perceptions of cleanliness, death. All those come sort of welling into your mind. This is a Freudian, Jungian sort of perspective that suddenly hijacks your brain. I sometimes talk about hijacking of your brain by the amygdala. So you didn't have that hijack. You didn't get hijacked that for the toilet paper. That's interesting.
That's a really interesting take on it, and the doing things to reestablish control. I think we see a lot in these gaps or these vacuums of information or perceived action from authorities. Let's dig a little bit deeper into that sort of thing. You talked about crisis comms, one of the outputs of crisis comms being affecting human behavior. In this case study, or more generally perhaps, how do you start achieving that when it comes to addressing these unknowns?
Well, I would argue the first approach is to understand how the brain is operating, what's going on in the brain under conditions of high stress, high concern. And it takes us back to emotions, perceptions. Facts don't speak for themselves. Facts are influenced by emotions and perceptions. And we know from the research now, there's over 20 different factors perception factors, emotion-based factors that influence people's behavior. The most important is not control, actually. Control is the second most important. The first and most important is trust. Do I trust those who are managing the high concern issue, the high stress issue? It could be as simple as managing, let's say, concerns about going out in bad weather or a potential of a flood, or it could be perceptions related to something such as toilet paper. Trust. Do I trust those that are managing the situation and communicating about the situation? And that was absent at the time of the toilet paper hoarding issue. Control is number two. Can I control my environment? Can I control my own destiny? Are my actions being controlled by others that I don't trust? And trust in turn is based on other factors. So again, we keep getting layers like an onion. We keep peeling back layers. Trust is based on, first of all, the perception of caring. Do I really believe that you care about my welfare? Do I really believe or perceive that you care about what's going to happen to me? Or do you have other priorities that you're trying to manage or communicate about? It goes back to an Aristotle statement. People want to know that you care before they care what you know. I think I've written that particular statement about 50 times, that in high stress situations, people want to know that you care before they care what you know. They want to feel that you are listening to them, that you respect what you hear, that you acknowledge fears as opposed to dismissing them as irrational in the process. And so that's the most important one, communicating, caring, listening, understanding as a way by which to get over the first barrier, which is trust. And then the second barrier is informing people, that we want to inform people so they can make good decisions. Well, there's another barrier, another wall that's up in front of it. And once again, noted by Aristotle, that when people are stressed, they have difficulty processing information. They can be easily overloaded with too much information. So therefore, we have to keep it what's proverbially short and simple in the process. One of the ways we do that is by sticking to no more than 3 messages at a time. It's called message mapping, where we decide what are the priority items we would think people need to know or want to know, and then use the opportunity of communication to share those 3 messages with layers of messages that follow. And the third barrier, now we run into another wall. So the first wall was the trust wall. We got to get over that. It's like outward bound. Grayson, did you ever, I know this, it was very popular back in the 1980s, outward bound, where you have to go through all these obstacles, walls, sometimes as a team. The first wall was the trust wall, or mistrust, distrust. Then you run into the cognitive overload wall. Too much information, I can't process it. And the third wall is called sometimes the negative dominance wall, or the loss aversion wall. It was identified by the Nobel Prize winner, Professor Daniel Kahneman, and that he indicated that in high stress situations, we tend to focus more on the negative than the positive. We get more weight to the negative than the positive, more focus, more effort, more money. And in order to offset a negative, we need at least 3 positives. He came up with a formula, 1n equal 3p. Which means if we want to address a negative, such as the perception of a scarcity of something we feel is essential to our lives, toilet paper, and you go deep in your brain, we have all these images going on, for example, of Jungian, Freudian images of toilet training, et cetera, that to overcome that, you need at least 3 positive messages to overcome the negative, which is the scarcity, and to dissuade you from engaging in the hoarding behavior. Luckily, we have all these nice little formulas that allow us to organize our thoughts. For example, the first one is the rule of 3. Organize your knowledge into 3s. That gets over the cognitive overload barrier. The trust barrier, people want to know that you care. And to get over the barrier of loss aversion, negative dominance, you need at least 3 positive things you can share with people, something they can do in order to get over the fight, freeze, flight phenomena that they're experiencing in their brain. I just try to do a review of a really a case study that probably could take a book if one really wanted to write about it. I don't think you'd sell many books though about the toilet training, but it fascinated me that all these different things were going on in a person's brain that would influence the person who was taking away my toilet paper. My brain was activated, fight, freeze, or flight. And I wanted to talk with her about how her brain was also activated by fight, freeze, or flight. I never got a chance to do so.
You know, it's so interesting you talk about that know that you care before you care what you know. I remember a meeting I was in with healthcare, talking about what we were actually doing in the pandemic. And we arrived at the conclusion that essentially we were fighting for the soul of Western medicine, is the trust in Western medicine. We weren't only looking for effective means of increasing operations. We weren't only doing surge planning. We really were trying to hold on to the trust in the healthcare system. And we've seen multiple examples through COVID of trust being the thing that breaks down and alienates people and divides people. So I really take that one to heart. We've talked a lot about the receiver characteristics and how people receive the information. Let's talk a little bit about the generators of the information and some of the best practices there. We talked about panic being a bit of a myth, but I think there's lots of cases and this emerging idea of elite panic or the leadership
Right.
panic. I'm wondering if you have anything to say on that.
Part of it, part of that elite panic, I mentioned a politician who used, in fact, it's been used quite a few times where individuals say, I withheld information because I didn't want to create panic. And so I would argue first is there's a lack of information, lack of knowledge about these many different factors that need to be simultaneously present in order for panic to occur, which means they may be less likely to say the word panic if they're aware of all the variables that need to be present. That might be one thing that I would recommend is simply be up to date in terms of our knowledge, recognizing that if all the variables are present, then we have another problem in hand. But nonetheless, the odds that those would all be present at the same time are very low. The next is adapting to the way the brain of the receiver, and Aristotle used a wonderful analogy 2,000 years ago. He said, a person is having trouble digesting food, and you're the caretaker. They need nutrition in order to stay healthy, but they're not hungry or they can't hold the food down. So therefore you offer up the food in spoonfuls, in small amounts, easily digestible, small amounts of food. I like that analogy because it also applies to information in a high stress situation, that the sender of information has to provide information initially in an easily digestible form in small amounts. And that is quite contrary to the way that many spokespersons or communicators speak. Why? Because we want to flood them with information. We're trying to do an information dump. I'm doing that today with you. I'm doing information because I'm assuming this is not a high stress, high concern situation.
I think this is the right channel for that sort of thing. Absolutely.
Right. And we can do those information dumps, for example. You can do it at a dinner table. You can do it with friends, for example. If you're watching a hockey game, for example, you could do a dump of all the information you know about hockey and how COVID has interrupted the hockey season. In a high stress situation, the brain will rebel on you. I mentioned before, the amygdala hijacks the frontal lobes of the brain, takes control of the information, starts off with keep it short and simple. And if we have that image in our mind, initially present the information in the shortest and simplest possible way, recognizing we're going to lose something. When you simplify, you lose information. At the same time, we gain the ability to be able for the information to be processed. The other was the other thing that, in terms of failures of communicators, is not recognizing that first principle. People want to know that you care before they care what you know. So even if you keep it short and simple, it's unlikely you'll be successful unless you passed over that first hurdle, the trust hurdle, which is saying something or actions or words or nonverbals that communicate caring, empathy, listening, understanding. It might be as simple as just repeating the questions. I know that people are having lots of questions about the availability of toilet paper. I know there are a lot of questions being addressed about the effectiveness of masks. These are legitimate questions that need to be answered. They're important questions that need to be answered. That was about 27 words of empathy, caring, that I would use as a way to begin the conversation. It's like tilling the soil. I'll use another analogy. Tilling the soil, that the seeds of the facts will not take until you till the soil with caring, empathy, and it has to be authentic too. People actually can read right through lack of true, authentic caring or understanding or listening. We have an incredible facility in our brains to be able to see when someone's faking it. And therefore, the nonverbals become critically involved, such as eye contact, facial expressions, hands, gestures, posture, all play a very critical role in how we evaluate the spokesperson in terms of caring, let alone competence and honesty and other factors that influence trust.
I can see this being a pretty delicate balance. The 3 positives to 1 negative, you go too far on that and really you're just sugarcoating a bad piece of news, the focusing on empathy and not faking it. So it does sound like a really impossible balancing act sometime. What can someone do to prepare themselves to deliver a message, or maybe even what sort of spokesperson or channel or format should be chosen to get these really important things across?
Well, there's a model that is used in the risk, crisis, and high stress communication literature. It's called APP. Anticipate, prepare, and practice. The anticipate is anticipate the high stress issue before it occurs. Anticipate who will be involved or interested or affected by it, and anticipate the questions and concerns that are likely to be generated by the high concern issue. That's the anticipate part. Prepare is you prepare the messages. I mentioned several things you can do for preparing a message, such as keep it short and simple, start with care and empathy, balance a negative with 3 positive, recognize there's marginal returns to too many positives, and prepare the messenger, the person who delivers the message. For example, have them do some videotapes of their nonverbal communication. Do they have good eye contact? What are they doing with their hands, their posture, their facial expressions, let alone the words? And most important are the actions supported by the words, supported by the nonverbals. And then the third part, so we have the A part, anticipate, issues, stakeholders, questions. We have to prepare part, prepare the messenger, the message, and the means of communication. For example, would I use a videotape? Would I use a fact sheet? Would I use social media, Facebook, Instagram, etc.? And then the third part, which is the one we often forget, which is the preparation part. Anticipate, prepare, and practice. That we practice. You start off by practicing by looking in the mirror and simply imagining yourself presenting the information, for example, to a town hall meeting or in a video broadcast, whatever it might be. Then you can do simulations, you can do rehearsals, you can do, and the best place I would argue to practice is simply at home. Example, Grayson, have you ever had an argument with a family member?
I've had arguments with myself, if that counts.
Well, maybe you start with yourself. Start off with some caring empathy to yourself. Grayson, I know that you get upset about things that perhaps you get more upset than is necessary. And that's legitimate. That's part of life. Our emotions can sometimes hijack our brain. So Grayson, let's look at it intellectually now. Okay, so you can argue with yourself, but you start off with the caring empathy. And if you look at it intellectually, you might have 3 things you say to yourself. Grayson, first, let's put it in perspective. Again, you're talking to yourself in the mirror. Let's try to put this issue in perspective. Given all the things you can worry about in life, is this really worth that much worry? Okay, you have to decide. Can you control the situation any more than you are right now? And is there any benefit, for example, of worrying about other things? And so then you say to Grayson yourself, let's talk about each. Let's go back and talk more about what are the benefits of worrying about this issue. Let's talk about, for example, whether or not this issue even needs to be addressed now, so you can have a conversation. The other is to actually start engaging in this type of practice with others. The little things in life. You go to a restaurant and they forgot to deliver your drinks, whatever, or got the wrong drink. It's an opportunity, for example, to practice what you preach. For example, I'll do a role play with you, Grayson. Role plays are the best way to practice. I bring your meal over and I forgot your drink, or I got the wrong drink. Instead of getting vodka and orange juice, I brought you a rum Coke or something like that. So what do you say to me as a waiter? Now, again, you have 3 goals related to the waiter. Number 1, you want to enhance trust. Number 2, you want to inform decision-making. And number 3, you want, most importantly, to influence their behavior. For example, when they go back to the kitchen, they could still hold back your drink. You would like your drink. You're thirsty. All right. So what would you say?
Well, let's see. Start with empathy. Oh my gosh, I know it's so busy. I seem to remember ordering a whatever it was. Would you mind switching out my drink?
That's right. There it is. And would this make you happy? You would say it would be very happy. And I really appreciate any effort you can put into this. Something of that nature as a way by which to practice what you preach. It really makes a difference. So you start off very close to home with yourself in the mirror. Then you move on to, let's say, those that are close to you. There might be more understanding. You might even tell them, I'm going to practice on you. I'm going to practice on you today. I want to practice my communication skills for high stress situations. You might even tell them what you're up to. For the negative, I'm going to have 3 positives. I'm going to start with empathy and caring, and I'm going to keep it short and simple. And can you give me a grade on how effective I was in my communications? And then finally, you might say, can you grade me on authenticity? Can you grade me on whether whatever I did here was authentic, sincere, as opposed to manipulative? And there's this razor's edge sometimes between persuasion, manipulation, influence that we walk on when we're engaged in high stress communication.
I really like the whimsical examples we've used, the toilet paper and the how not to get your drink spit in and all that sort of stuff.
Yeah, no, I didn't mention that was one of the behaviors we were trying to avoid, right?
That's right.
And you were informing the waiter's decision making that I'm quite thirsty, and it'd be great, for example, you are indicating your emotions at the same time as you're indicating your needs. And you're right, the behavior might be spitting in your drink or simply not, disappearing into the kitchen for the next half hour, so that make you suffer because you were rude and disrespectful to the person.
We've talked a lot about the different things you can do to deliver the message, the sort of state of mind you can start recognizing in yourself when you're receiving the message. I'm wondering if you can drive this home with a few examples from your work or from past disasters that might be in your book, including maybe some where you weren't as successful as you would have liked.
Yeah. So actually, I'm going to start off with a failure. 1 N equals 3P. So if I give you a failure, I have to give you 3 positives. But nonetheless, a failure is that it was one of the first major assignments I had. It had to do with a nuclear energy facility, nuclear energy. And what was important about this facility is that it wasn't for making for nuclear power, it was for nuclear medicine. Saves lives, a very important sort of use of radiation and doing research on radiation, especially in medicine. And the problem was that they called me in because they told me that they had a leak, that their reactor was leaking radioactive contaminated water. And they said, we're trying to decide what to do about this because it's a very small leak. We're talking about a hairline crack, for example, maybe a drop every hour of radioactive water that's going under the facility into the groundwater. There's no environmental harm expected from this. There's no health harm. And therefore, we basically have tabled the issue for a number of years, fixing the hairline crack. It would cost millions and millions of dollars to fix the crack, and just wanted your advice on this. And I said, well, radiation is one of those high stress, high concern issues that you want to be, it sort of raises a flag as soon as you talk about radiation. Invisible, it's a lot like a disease, a virus and things like invisible, dreaded, lack of control, unfamiliar as a source of possible health effects, et cetera. And I said, well, even if it's a drop, my initial studies were I did a textbook on epidemiology, and I recognized that there are ways we determine whether or not it truly has a health or environmental effect. We're dealing now with people's emotions. We're dealing with their perceptions. And given that radiation has almost all of the 20 perception factors that increase high stress, I would say fix the crack, fix the crack. They ignored my advice. They ignored the advice. I said, from a technical perspective, don't spend millions on the crack. It's not going to make much of a difference in health or environment. From a communication and emotional and a risk communication perspective, fix the crack. And so I was speaking to them as a risk communicator, not as an epidemiologist or a toxicologist. They ignored it. The issue, though, came back to bite them. And it bit them in the following way. They had a vote to take about what to do. They had a surplus of money. For a variety of reasons, they had a surplus of money, and they had to decide what to do with the extra money they had. And they put it up for vote within the organization. what do we do with the extra money? One item on the vote for voting purposes was to fix the hairline crack, this drip, drip, drip into the water. The second was to give the money to the coffee club. And they would be able to get a nice coffee machine. Often they would have visitors and they would complain there was no coffee. People had to go all the way to a cafeteria in order to get to the coffee, et cetera. This way we could have some coffee locations. It also might be good for people talking to each other around the cooler, et cetera. So the two choices offered on to the members of the organization were, number one, fix the leak of radiation dripping into the groundwater, and number two is put it into the coffee club. Grayson, try to think like an engineer now. You're an engineer, or a toxicologist, or an epidemiologist. Where would you put the money?
Well, I happen to think coffee is pretty darn important, but it's interesting you bring this up. I assume the answer is they went into the coffee club, but I think you've hit on something that often impacts our profession, is this idea of doing a risk analysis. And more I see organizational risk matrices include reputation. And I think that would be a good way to sort of incorporate talking about risk outside of a technicality. So did it go into coffee?
It went into coffee, and then in today's world, it's very hard to keep information private. Someone spilled the coffee beans, proverbially, and it got into the local paper that this facility for nearly 15 years had been dripping radioactive contaminated water into the drinking water system of the community. And decided, rather than fixing this, they decided to put it into their coffee club. Consequences, huge outrage. Professor Peter Sandman talks about outrage, that risk is made up of the hazard, the results of the risk assessment, the one you mentioned before, the technical analysis, plus emotions, the subjective evaluation of those factors, such as trust and perceived benefits, control, familiarity, effects on children. There's 20 in total, and it created outrage. The next thing that happened was the politicians abandoned. They saw the writing on the wall, that we've lost public support for this facility. There was always some controversy about it to begin with because of radiation and using nuclear energy as a way by which to do research. And the facility was closed down. It was closed down, quite literally. We lost a major asset in our medical research spectrum as a way, because of a failure to recognize how important are emotions in decision-making. Risk assessment is still important. We need to know what the risk is. It would be lack of due diligence if they didn't do the risk assessment for what the drop, 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 drip, drip, drip was occurring. Then we take that kernel of information and have to have these layers and layers of other information that people use to process whether or not there's a risk present, whether or not they're concerned about the risk, stressed about the risk, or most importantly, outraged enough that they will take action against you or your facility.
Any success stories or examples?
Success. Let me throw another dimension in, culture. That all these variables are affected by something which I haven't even mentioned so far, which is culture. We're seeing this right now, for example, with COVID, where culture and such as political affiliations will influence your decisions about vaccination or mask wearing or social distancing or any of the behaviors. So we have a culture, could be organizational culture or ethnic culture or national culture, political culture, all influences. And I think if I'm thinking back of all the cases, years ago, I was in an Asian country and there was a major industrial accident that occurred, an explosion. Horrible event causing death and injury. And in order to fix this situation, workers would have to go into the industrial facility in order to turn off lots of wheels and knobs, et cetera. And 50 individuals had volunteered to go into the facility, risking their own lives because there was still a possibility of another explosion. 50 workers stood up. One of my favorite films is Spartacus, where the Roman legion general asks, which you is the escaped slave who's leading the rebellion? And Spartacus stepped forward and said, I'm Spartacus. And then there's a beautiful part of the film. I'm not sure, Grayson, if you ever saw the film, it's Spartacus. But what happened next was that he had several thousand escaped slaves with him. And the next slave stepped forward and said, I'm Spartacus. And then all 2,000 of them said, I'm Spartacus. It was just thrilling to watch this. Well, 50 workers decided to step forward and volunteer to basically put their lives at risk for the greater good. In this case, was to effectively prevent another explosion from occurring. And the organization I was working with had robots that they were willing to give to the organization instead of having the workers go in. These were robots that were very specialized robots. They could thread a needle, they could do very fine work, etc. And the organization that had the explosion refused. They said, no, the workers have volunteered and we don't want your technology. I thought this was amazing until I started thinking about what's going on here. What might lead them, for example, to say no to an offer a volunteer, you can have my technology. You don't have to have workers potentially sacrifice their lives. So Grayson, let me throw it at you. What do you think is going on in their minds? This is where we have to effectively, the true empathy, where we try to see the world from someone else's eyes, try to walk in their shoes, try to live their lives. What possibly could lead to a refusal? Now, I gave away a little bit when I said it's an Asian country. I'm trying to be as unspecific as possible because I believe it's the lessons we learned and not the, but nonetheless, the very fact that I said it was an Asian culture, does that suggest anything to you?
Well, I don't know about this situation, but I know from just in general responder culture that there's a great deal of ownership and pride and sort of honor that comes with being the person or being the group that goes and responds to, and taking that away from the group that has the core responsibility could be super damaging to morale. I'm wondering if that has anything to do with it.
No, very much so. And in an Asian culture where face, honor plays such a critical role in motivating human behavior, there also is another characteristic besides losing face, ownership, pride, etc., is that you have to borrow someone else's technology. This particular organization prided itself on its technology, and the fact that they have to borrow someone else's technology in order to solve a problem that they themselves created is a loss of face in the process. And so the suggestion was that we do the following, that starting off with caring empathy, again, I'll skip that part because we discussed it before. What are the 3 messages? Rule of 3, 27 words, 9 seconds, 3 messages. That's called the 27-9-3. First message. First, I want to say how much we admire your courage. The fact that 50 workers would volunteer to step forward, put their lives at risk is outstanding and a high degree of appreciative courage seldom seen. Number 2, do you see where I'm going? So the first is that, respect for their, the courage, the pride involved. Can you see where I might be going next? What would be the next message that I might be able to share under these circumstances?
Maybe now that you've established the caring, you could start with the knowing, kind of understanding the risks and the options. I don't know.
Well, actually, we went a little deeper. We said that your culture is well known for the courage of individuals willing to give their lives for the greater good, known throughout the world. And third message was that we would be honored if you would allow us to be a member of your team in responding to the accident. We would be honored if you would allow us to be members of your team to respond to this situation. Next thing, they said, we'd be honored to have you as members of our team, and please bring your robots with you.
Excellent. Meeting them where they live in the communication. I really like that.
Right.
Now,
It was almost like an afterthought, but in fact, it was a thought, and
Hmm.
they recognized that. I don't like the expression sometimes win-win because it has some negative possible implications in negotiation. When the whole notion of winning, as opposed to collaborating, partnering with individuals, is the way I prefer to perceive it. But nonetheless, this was very close to a win-win.
Amazing. Now we've touched on this a little bit, the channel or the means of communication. I know that things are changing and there's more information out there than ever before. Let's read that as road. Social media is here, it's here to stay. What else is changing in the way that we perceive information, maybe socially, culturally, technologically, or even neurologically? And what isn't changing? What can
Yeah.
we rely on?
Well, the first change, which I'm glad you put a boldface and underline, is the dominance of social media as a way to acquire information about high stress issues, be it COVID, be it, for example, flooding, be it uh, uh, budget cuts, whatever it might be, is that the primary means that people now use as a way to acquire information is through social media. Um, and that is a practical implication, that if that's where people are going for information about a high stress, high concern issue, you have to be there. You have to be on the playing field. If you're not playing on the field, the social media field, if you're not have a presence, for example, uh, Google search would be a classic example. A few years ago, I did a Google search on an organization I was working with, and the first hit was a Wikipedia piece. So it was totally negative about the facility. And they said back, well, that's junk. Wikipedia is what someone has to say. But I said, people are looking. That's where people are looking. And if they're looking there, you have to be there as well. Then you have Instagram and Facebook, and even that's a changing environment. It's very frustrating because I met a son of a young son of a friend of mine recently, and I said I was doing research on Facebook and how people use Facebook as a way to acquire information about COVID. And he said, "You're in the wrong place. That's not where we are. Only the old guys like you use Facebook. We use Instagram. We use TikTok." So just to stay abreast of social media, let alone knowing that's where people go for information. The second major characteristic, though, is that you mentioned it before, loss of trust in medical science, but is broader, loss of trust in science and loss of trust in experts as a relatively new phenomenon that we're experiencing. When I was a kid, for example, when the doctor would come to our house, would say, give the kid X, Y, Z, and that there was no challenge to it. There was no searching on social media to see whether or not aspirin is the best solution, for example, for keeping down a fever, whatever. My parents accepted that authority. Same thing happening with science now in terms of virtually every field of science. Where there's been a huge erosion of trust in science and expertise. There's even a book by Nicholson called "The Death of Expertise" as a phenomenon. So how do you navigate a world where there's a lack of trust in experts and people are getting information from social media which are not the authoritative sources? So how do you navigate under those? It's almost like you're navigating in a fog, and there's lots of obstacles. You might bump into an island or a sandbar, et cetera. How do you navigate under those circuits? So I'm going to throw it back at you. How do you navigate when there's a big fog out there created by social media and a lack of trust? You don't trust your navigator, you don't trust the captain, and you can't see in front of the boat. In fact, you're listening to all the rumors coming from below decks.
It's so interesting. I've seen more and more positions come available for this idea of like knowledge translators. It's the what's next for the researcher, because I think that is being recognized, is that, okay, it's one thing to do the research presented in a journal and have that sort of authority, but translating that knowledge into culturally appropriate means is an entire skill set unto itself. And I think the last couple of years, this is probably the first time I've seen these job postings for knowledge translators in that fashion. Is that an example of this?
Yeah, that would be an example of it. Another example of it was that there's a whole new breed of influencers out there, experts called influencers. Influencers. They were used very effectively, and I believe are still being used very effectively in one of the most successful communication campaigns, and that was the one initiated by the World Health Organization, Mythbusters. They were noticing that a lot of information was being shared, both misinformation and disinformation. They made a clear distinction between the two. There's misinformation, where people misunderstand an issue, and there's disinformation, where people are purposely sharing information they know is not correct for some other purposes in mind. And that was spreading like wildfire, both misinformation and disinformation. I ran into that in my own, I have a small garden, and the person I work with who helps me out with some of the heavy lifting, he said, I know you're working, Dr. Covello, on COVID issues. I just read someplace that if I'm worried about being exposed to COVID, I should take a hairdryer and put it up my nose, put it on high, and it'll kill all the germs. So if I feel I've been exposed, just use the hairdryer. It'll be all over. What do you think? What do you think?
That sounds like disinformation, aka trolling to me.
Right. Actually, that was one of the ones I believe that eventually WHO listed about 25. The way you can determine if you have COVID is by taking 10 deep breaths, taking a cold bath. There were some strange ones there, injecting yourself with bleach. You may have heard that one before. The way to respond to it is I started, which is one of the most effective ways to communicate, is to try to put yourself in the other person's shoes, see the world through their eyes. And I started probing, asking questions. That's interesting, and also it's important. If that's the way that you can solve the COVID problem, that certainly is useful to know. Can you tell me where you got that information? So I immediately started a conversation with him, a dialogue, to better understand where he goes for information. It's equivalent to intelligence gathering. I need intelligence before I can proceed to communicate. I do want to share facts. I want to be respectful, and to share, be able to share those facts and be respectful, I have to understand. And I began by asking, where did you get that information from? And he shared, for example, the particular social media chat room that he is involved with. And then I started asking some other questions. Well, when you have a cold or when you have a backache, or where do you typically go for information when you have a health problem? And he shared with me, for example, that he talks to his local doctor. He said, I trust my local doctor. And so if I've got, for example, a cold or flu or a backache or something, I bring that up to my doctor. And I said, well, have you brought this up to your doctor, what you just suggested, using the hairdryer? And he said, no. And I said, that might be worthwhile getting that second opinion in medicine. Second opinions are valued. So you might want to get your own doctor to give you a second opinion on this and see, for example, what the doctor will say. And he said, sure. And the next time I met him, he said, the doctor told me I was the stupidest person in the world. Now, I didn't say that. And in fact, I was a little embarrassed for the physician who started off with perhaps what I was thinking, but didn't say, that you probably get to fry your brain at the same time as you fry the germs in your nose. But nonetheless, I tried to my very best to be caring, understanding, empathic. The technique I was using was questioning. Tell me how, for example, how do you think, for example, I've been asking other questions. How do you think, for example, the hairdryer will, yes, it will affect the germs. Do you think it might affect, for example, your nose, your ability to breathe? How might, for example, it affect your brain, which is, for example, up? And we really had a really interesting conversation. And I even took out a picture, for example, of the nose, the navel cavity, on my iPhone, just to show how the nose is connected to the brain, and you're likely to cause, or at least we should be thinking about possible other damage you might do other than to the germs, the COVID germs or virus in your nose. So that's the procedure. And you can practice this on a daily basis. when you eventually get into a really big issue, such as we're dealing now with pandemic, when you deal with big issues that have major stakes, major consequences, I would argue all that practice will pay off. You've been doing it on a daily basis.
Amazing. Dr. Covello, thank you so much for joining us for this epic podcast. I wonder if you have any closing, maybe 2793 statement, or where people can go to find out more, maybe even your book.
Right. Well, I not want to be self-promoting. There is a book out there, a 500-page book, which has, each chapter has about 30 pages of references. There are 14 chapters altogether, and each chapter I overloaded with references because I feel people have a right to know where information comes from. That if you say something is factual or truthful, that people should be able to explore that in more detail. That would be the first thing, is simply that we have a right to know where information comes from, which means, for example, when you, let's take something, we didn't have a chance to discuss this. One of the problems affecting, for example, the research community, people now publish things without going through the peer review process. They immediately hold a press conference and announce their finding that XYZ causes COVID, or XYZ will prevent COVID, et cetera, without going through all the bells and whistles required by science. And I would look very carefully at where information comes from and do the exploration necessary before we make decisions, informed decisions. So I'm going to come back to APP, my last: anticipate, prepare, and practice. Anticipate issues. Who's going to be interested, affected, anticipate the questions, prepare the messages, prepare yourself as a messenger, prepare whichever method you think is the best to communicate, such as face-to-face, or, for example, in interviews such as the one we just did, and then practice, practice, practice. If it's high stress, high concern. If it's low stress, we can be much more relaxed. But I hope that we had a relaxing session today.
Well, there you have it, ladies and gentlemen. Dr. Covello on how to buy toilet paper, not have your drink spit on, and how to prepare yourself for dealing with communications under crisis. Thanks so much for joining us.
Thank you, Grayson. Pleasure. It's been a pleasure. Thank you.
You've been listening to an Epic Podcast production, a proud partner of the International Association of Emergency Managers Canada, and a member of the Alberta Podcast Network. Locally grown, community supported.
As always, Epic Podcasts are designed as a supplementary educational tool for the EM professional on the go. The views and opinions explored during this podcast do not necessarily represent the agencies or organizations that we or our guests may belong to.
For more information about the show or the people on it, visit our website at epicpodcast.ca or follow us on Twitter at username epicpodcast.
Stay tuned for more on the next episode of Epic Podcast, Current, Relevant, Canadian.